Recording. So we're here for an hour today, and what we want to do is just outline the details about the Green Nursing Challenge, what's involved. We're going to hear from colleagues from the Centre for Sustainable Healthcare and with colleagues who have kindly agreed to partner with us for the challenge. There'll be opportunities for questions and answers at the end of the session, and also further links to application forms and more information should people be interested in following this up. So we'll get started. I just want to check that my slides moved on there for you. It's moved on for me. Yeah, brilliant. Okay.
Yeah.
Brilliant. So the Green Nursing Challenge is a national leadership and engagement programme led by the Centre for Sustainable Healthcare to enable nurses to lead and implement sustainable healthcare initiatives and improvements in patient care with the additional benefits of reduced costs and reduced carbon emissions. So it's a competition to promote sustainable practice in nursing to help meet the green NHS net zero targets. It's been fully funded by Microtech UK, and it's in partnership with the Queen's Nursing Institute and Foundation of Nursing Studies. And we will hear from our partners in the session a little bit later on. But before we do, I'd like to introduce Lucy Brown, who is the Clinical Delivery Lead at the Centre for Sustainable Healthcare, who will explain to us why nurses are so important in this venture. Are you okay, Lucy, to carry on?
Yes, absolutely, Angela, and thank you for the introduction. I just wanted to reiterate your thanks, Angela. A huge thank you to Gareth and the team at Microtech for funding this project. So it's fully funded, so all of you have free access, which is absolutely wonderful. So huge thank you, and an enormous thank you to our partners, Queen's Nursing Institute. Amanda, thank you so much. I know Marion's here from the from FONS as well. Thank you so much for supporting this initiative and making sure we can share far and wide the nursing and midwifery communities to really benefit. Also, big thanks to the Royal College of Nursing, and they're very supportive of this venture. Rose Gallagher and also Emma Pascali Blakely, who has been brilliant in her support at NHS England. So I think I'll stop saying the thanks now and tell you why this is so important to the nursing community. It's something I'm going to tell you a little bit about myself so you get insights, but I came into the sustainable healthcare world probably about 3 or 4 years ago after designing a leadership programme. And once I learned about the planet and our populations, I felt completely compelled to do something. I'm hoping those of you that joined today, feel the same. And I truly believe, I'm a very proud nurse, I truly believe we can lead the change that we so desperately need to see. And this is part of that journey. We can demonstrate we're on the front line. We touch patients from cradle to grave. We can influence what they do. And this project is part of that initiative. You know what you need to do. You see waste in and out, you see inefficiencies in our practice day in, day out. So your projects are just going to highlight how fantastic nurses are at leading this change. But we're going to give you the tools to measure that from a carbon perspective, financial, and that social impact and patient outcomes. The average project, which is fantastic, saves £59,000. So no budget holder is going to be upset with you for saving that for your trust. And that's about 56 tonnes of carbon, which is obviously something that floats my boat a little bit more. So we can really cut carbon out of our health and social care systems. I really, truly believe you're going to lead the way. You're going to be exemplars of practice. So I guess, don't worry, you will come up with barriers along the way through your projects, but keep going, keep pushing forward, because I really do believe we're going to see some change, cataclysmic change, I think, in a good way, across our system, led by nurses. So keep going, and we're here to support you every step of the way in your journey. And I'm just going to take this opportunity to share a very exciting update. And Andrew, I hope that's okay, and then I'll hand back to you. We've been awarded, we have a great start to the year. The Centre for Sustainable Healthcare have been awarded some funds by the Burdett Trust, where we can now train 1,500 nurses a year on sustainable healthcare. So there'll be more coming this way. We'd love your support, and this is the first step in really empowering our nursing communities to lead that change. So more on that, but I'll hand across to Angela. But best of luck with your projects. Really can't wait to see them. And if you're not successful, there'll be a lot more opportunity to upskill yourself, your teams, your managers, and your chief nurses as well, and chief midwifery officers as well. So lots more to come, but I'll hand back to Angela. But thank you so much for joining us today.
That's brilliant. Thanks ever so much, Lucy. You're so inspiring in how you speak. So as Lucy said, what we're giving you today, really, what the Green Nursing Challenge does is give you the tools to be able to implement those changes. And the Nursing Challenge will educate nurses to implement sustainable quality improvements into your practice. Nurses can promote sustainable value by embedding certain principles that I'll go through in the next slide. But these principles help to improve patient outcomes, patient experiences, maybe staff experience. They can help reduce costs and massively reduce the environmental impact of care, which is huge. So the principles that I've referred to are the principles of sustainable clinical practice. And this might be a new concept to you, but when I actually talk through it, it will make more sense. And you probably recognise a lot of these interventions and these goals within your current practice. So there are 4 in sustainable clinical practice. The first is about preventing disease prevention and promoting good health in our patients by tackling the causes of illness and inequalities. The second is about patient care, so empowering our patients to take a bigger role in looking after themselves, in managing their own health. So these 2 principles essentially help nurses to promote better well-being in our own patients. If our patients are well, they don't need input from healthcare services, they don't need nursing care. So it's about promoting that. The third is about streamlining care, so creating a leaner service to minimise those wasteful activities that Lucy's referred to, those duplications, those inefficiencies that we all get frustrated with in our working lives.
It's working.
And the fourth is prioritising treatments and technologies with a lower environmental impact, so taking up these lower carbon alternatives. So essentially, the Green Nursing Challenge helps to pull all of those principles together. We've made reference already, Lucy's thanked them, and I'd like to formally thank both our sponsor, Microtech UK. Unfortunately, neither Gareth nor Jess could join us on the call today, but they're very engaged in the process and want to hear the successes, hopefully, that they've helped facilitate. So thank you very much to Microtech. Thank you as well to our partners, the Queen's Nursing Institute and Foundation of Nursing Studies. I'd like to invite both of these groups to speak. I'd first like to introduce Dr. Amanda Young, from the Director of Nursing Programmes at the Queen's Nursing Institute. Over to you, Amanda.
Hi, and this is such an important aspect. Obviously, we are completely biased towards community nursing, community and primary care nursing at the Queen's Nursing Institute. We support community nurses who work in all sorts of areas, and I think that with the prevention being one of the key areas, I think that community and primary care nurses are set up for this sustainable project right from the very, very beginning. They've told us in some of the work that we've been doing that they don't always know where to go within an organisation to find out how they can make a difference. And I think the opportunity to undertake this Green Nurse Challenge is going to be really, really beneficial. So we're involved, and that's the reason we're involved, because we want community nurses to be put on the map, to have more education, to be able to fulfil more sustainable practice in primary and community practice. And there's quite a lot of stuff that's already going on, but it's not very well advertised. They don't shout about it quite so much. We do shout about our projects that we run at the Q&I, our innovation projects. I see one of our innovation project leads on their call today, and they can make such a difference with small amounts of money. And the changes they make are incredible. And that you're absolutely right that nurses are key, because they can see the problems from the bottom rather than having it right from the top. And I think that they see things in a very different way in the community about how you might address things such as wound care and the whole process of wound care, not just the dressings and the recycling bit, but actually how that works for procurement in some areas. I know we've got some projects nationally that have looked at the whole systems of wound care and how that's made a difference. So I think that, and with the obviously during COVID, the increase in digitalisation is also a really big area of primary care, and that's made a big difference from a sustainable perspective. But I think there's so much more to be done, and the community and primary care nurses are really, they have ideas, it's just knowing where to go, and I think this is an excellent opportunity. So I'm really looking forward to taking part and being involved in the projects, and I can't wait to see all the applications. So good luck, everybody.
Thanks very much, Amanda. That's amazing. Thank you. And next, I'd like to introduce Dr. Marion Lynch, who, among her many titles, is one of the trustees at the Foundation of Nursing Studies. Over to you, Marion.
Thank you, Angela, and hello, Amanda. Great to be in unison with all of these advocates for nurses' voice and nurses' views and nurses' innovation. I'm speaking on behalf of the Foundation of Nursing Studies. So in case you don't know, we're here as partners because FONS helps nurses lead innovation in the workplace and improve care. We're a nursing charity helping nurses to develop person-centered workplace cultures and deliver compassionate care, and we deliver educational programs and supervision that help and develop individuals' nursing skills and resilience. We design and deliver large educational programs that improve workplace culture and support nurse well-being. But you know, whilst that's a big ask, it's still not enough, and we are nurses, so we can do this. We also need to think about the world's well-being, the bigger culture challenge, how to be compassionate about and how to care for our planet, and how to be person-centered and planet conscious. And that's why we're here in partnership with you, bringing the partnership of nursing art and nursing science together. So a quick sort of look back, you know, I'm a nurse. I was trained as a nurse in the 80s, and the surrounding environment was always part of my responsibility. But these days, the environmental responsibility is bigger, that we can touch or not touch, hear and see. And as nurses, we know the climate crisis science, and we know much of the impact of our own actions on healthcare. But we don't always know what to do to help, and that's why we're here. And from my aspect, that's how the arts can help. The art of nursing includes how we creatively act to help the planet. Quick nerd note, did you know that looking at a leaf can cause you to become calm? In biology, down to the chemicals in our brain and the response to fractals. Fractals are a science bit, a nerd word, part of complexity thinking. Fractals are the repeating patterns all over nature. An obvious example is a snowflake or a cauliflower. Quite frankly, looking at a cauliflower does less for my neurotransmitters than being in a nature space. And that nature space can be reproduced inside. And this is the space where art and science meet, and where nature and nurses meet. Now, there are many arts and hospitals charities doing this, whether it's original pieces of artwork from paintings in hospitals, because research shows that it's the nature images that people appreciate and have the best impact, or it's corridor murals from hospital rooms. People have started taking their chairs into the corridors where the murals of leaves and nature are there to have their lunch or meetings. Our planet helps our health, uniting our biology and our ecology. And it's this before we've even got out of the hospital, before we've even gone for a green walk with our service users, or tried, as you're doing, to change people's behaviours or improve quality. So harnessing the impact of nature is part of our nurseness, whether opening a real window, as I was taught to do in the 80s, or opening an imaginary one of artful interpretations. The creative approaches as part of the Art of Nursing movement has some synergy with you as the sustainable team here. We have webinars in partnership with the RCN that showcase artists and the projects, and a book out soon that Angela's written a chapter in that will feature this green challenge as well, on how nurses are delivering the Sustainable Development Goals. It's therefore with great excitement and nursing expertise that we join with you in partnership to marry person-centred and planet-centred care.
Angela, you're on mute.
Angela, you're on mute, I'm afraid. Well said.
Thank you very much for that reminder. So the Green Nursing Challenge, the practicalities and the details. So today marks the launch, so there'll be loads of stuff out on social media. So we're accepting applications from today. We've got an 8-week period where we're recruiting, and our closing date is the 21st of March. So 6 teams will be shortlisted, and they'll be informed by the 7th of April. We are allocating half of our places to community nurses to try and encourage uptake from that group. And we will be keeping the details of all those applications. We will be gathering those because there might be opportunities for these teams to become involved in other sustainable health practices and education that Lucy's already spoken about. So the workshop forms the next phase, and the workshops consist of 90 minutes of learning opportunities for each of the teams to learn more about sustainable healthcare principles, to learn about the SUS-QI methodology. And the Centre for Sustainable Healthcare will support the teams to, throughout this learning process, and they will help them maybe develop their ideas further. The project phase is where the teams have 16 weeks to actually undertake the project. And during this time, Centre for Sustainable Healthcare colleagues can meet with you as often as you like, as often as needed. And this support also includes working with our environmental analyst to do the carbon footprint, do the number crunching. At the end of this phase, teams will have to submit their project by the 29th of August. The Centre for Sustainable Healthcare colleagues can help with the writing of these projects as well. So you've got a 16-week time period to actually undertake your project work. The showcase event is the event that is held in October of this year to celebrate the learning and achievements of all of the teams that have been involved. So the teams will present their projects to a judging panel. The panel might ask the teams questions, and a winner will be chosen. All the projects will be shared by the Centre for Sustainable Healthcare and our partners through social media, so you'll be famous. There will be an opportunity for the teams to contribute to further learning for nursing through a stakeholder debrief meeting, and there will also be an impact analysis meeting a year after the end of the challenge. So we don't just leave you to your own devices, we kind of want to follow up how things are going with the actual implementation of the project. So we have criteria in order to shortlist, and I'll just talk through that so you'll know the kinds of things that we're looking for. So we're hoping to get several applications and narrow it down to just 6 teams. And as I mentioned earlier, we're dedicating 3 of those places to community-based projects. Now, the shortlisting criteria, number 1 is the applicant has to stress the purpose and the motivation for the project. They have to identify the problem and how it relates to the sustainable principles that we outlined earlier. The application should outline possible solutions and how feasible it is to address these, which kind of leads on to the next shortlisting criteria, which is asking the applicant to demonstrate how committed and how supported they are by their organisation. And the 5th criteria is just looking at the overall application in general. So in order to kind of explain how this might look, I'm going to invite Kath Richards from the Centre for Sustainable Healthcare, who is the SUS-QI programme lead, just to go through a couple of examples of green team competition work that's been done, some projects that have been undertaken, and I'll hand over to Kath.
Thanks, Angela. I hope you can hear me okay.
Yeah,
just to say this is really exciting launch event today, and great to see so many people on the call. So I've just got a couple of examples from previous competition projects to show you, just for a little bit of inspiration. I'll talk a little bit at the end of where you can find more case studies to have a look at. But this first one is from a team of nursing colleagues from South Warwickshire Foundation Trust, who took part in a Green Teams competition. I think it was towards the end of 2023 now. So they were looking at routine blood testing on several of their wards, really understanding that routine blood testing has adverse environmental impacts due to all of the consumable use, the testing process itself, waste disposal, and all of those factors involved in the process. And many elderly patients on the wards they were looking at were subject to regularly, I think up to daily blood tests during their inpatient stay, all of them not necessary. And the overuse of testing is quite commonplace in this population. Obviously, this is not great for patients, particularly in that population where frequent testing can cause things like bruising and skin damage, time consuming for staff, and had significant financial and environmental costs as well. So the team used the QI methodology to initially study the system, understand what was happening within the wards that they were looking at, and the processes, understand what changes that they needed to make. Some of the changes that they made were the primary change that they made was to develop a decision-making tool for clinicians to guide whether the blood testing was appropriate or not. And they also developed a communications campaign around this and some education materials for staff as a kind of raising awareness, but also so staff knew what to do. And in terms of the outcomes of this piece of work, and in just quite a short amount of time, they were able to reduce testing across the 3 wards by almost 10% in the timescale of the competition, which really is a small change, but has significant clinical outcomes when you think of it from a patient point of view. Obviously, you know, reduces the risk of bruising and skin damage for patients, and just the unpleasantness of having to have blood tests. It increased the flow of hospital, and then the benefits of the environmental and financial savings as well from the reduced consumables and the processing of those blood tests that didn't need to be done. Staff, a positive impact for staff, also saving time, meaning that they're able to gain time to focus on higher value work within their working day. And also the potential there wasn't really captured in the timescale of the competition, but real potential to save lab processing time for the staff at work in the labs. And really, when you think of that over a 12-month period, it's a huge amount of time for staff. So that's just one example when we're thinking about that lean pathways and kind of low value work and streamlining pathways for patients and staff. And then the next example we have is, you can move the slide on, Angela. Thank you. Is from a nursing team from Sheffield Teaching Hospitals. So they were focusing, so this is really thinking about that principle of low carbon alternatives and switching from single use to reusable items. And I know for many people who have been in nursing for a long time, this is really going back to practices that we've done before. So they were aiming to replace single use tourniquets with a reusable alternative in a kind of small selection of services, focus services. Again, using that quality improvement methodology to test the change initially and then measure the impact of the change, with the ambition really to scale this up across the organisation, not in the time frame of the Green Teams, but eventually. As part of this process, really importantly, and will be important for any work, is to engage a range of stakeholders. So obviously clinical staff that are involved, procurement teams, infection prevention control teams, most importantly, patients. And that is a real kind of emphasis, I think, probably on applications of thinking about what the patient impact and how you will involve patients in your work as well. And really to make sure that this was a safe and effective switch. So through the competition process, their trial was really successful, and they were able to implement the reusable tourniquet in the service area they want to, and very much have plans to scale this up across the organisation. And kind of from that outcome perspective, when we think about that sustainable value outcomes and how they're able to measure that from a patient perspective, they were able to interview patients and survey patients, definitely more comfortable. And patients care about the environmental impact as well, so it's positive from that perspective. Staff found the reusable safer and easy to use, and there was significant carbon and cost savings, which particularly when scaled up across the organisation is going to be even more significant. So I'll post the links to these particular case studies in the chat, but also we have lots and lots of these case studies from previous competitions on our resource library. We'll let you know how you can, so if you click through these links, you'll be able to access the resource library. And if you search, you can search under SUSCY case studies. So there's just lots and lots of examples there of nursing examples, but examples from other healthcare professions of types of projects that might give you a bit of inspiration. And I think, as people have said, the emphasis really, these two particularly have been around those kind of lean pathways and low carbon alternatives, but really thinking about prevention and patient empowerment principles. We've got lots of examples there, but thinking about, yeah, how kind of more upstream, what we can do, and probably stuff that you're already involved in and already doing, but thinking about how we can apply this methodology and measuring the impact of it. So yeah, thank you, Angela. I shall leave it there. I'll put another link to the resource, like a general link to the resource library as well.
Brilliant. Thanks very much, Catherine, for stepping in at the last minute as well. You've been amazing. Thank you. So the Green Nursing Challenge, you can either access it through the QR code, or there are links that we'll place in the chat as well. Do share it with your colleagues. Like I say, like Kath's mentioned, the resources that are on our website will just give you kind of ideas. You can scroll into certain networks that might be more relevant to your area of work. So do use all of those resources that Kath's talked about, and we'd love to hear from you. So I'm going to stop sharing my screen now and kind of open up the floor to any questions.
Feel free to put any questions in the chat if you don't feel comfortable. Have a look. I'm just going to pop in the chat as well while you're thinking about any questions you may have. We'd love you to, I know there's 40 of us on the call, so it'd be lovely if you haven't done so already, if you could join our nursing and midwifery network as well. There are loads of resources and you can meet like-minded individuals as well. So I've popped that on there for you. Oh, Victoria's got it.
Victoria.
Hi there. I was going to pop it in the chat and then I thought, no, just be bold and talk.
Go for it.
So I was just wondering, because obviously the examples that Catherine gave were fantastic, and you start thinking about the little things that your teams have already mentioned, and I was just wondering, and I think I know the answer, but I was just wondering in terms of scale, if it's little change, big impact, is that is that the sort of thing that you might look for, or are you looking for something a bit more upscaled, sort of organisationally driven?
I would say that we're looking for both of those things. I think from a scale point of view, if we're starting small, does it have the ability to be scaled across the organisation or across that specialty? But I think both, Victoria. I don't know if you'd agree there, Lucy, or other colleagues
I guess
in the call.
I would steer towards the small incremental changes can have a big impact, and then they're applicable across the entire health and social care system. Just from experience from running similar projects, not quite as big as this before, but the ones that have had the biggest impact and the easiest to implement are those small incremental changes. But Victoria, goodness, if you could find a project that also then is organisational change, that would be phenomenal too. So open to all ideas.
So I can see that there's a couple of questions in. Sorry, has that answered your question, Victoria, before we?
Oh, hang on.
Well
Sorry.
done for going first. It's always good to always a bit funny to go first.
Using Teams for 5 years and I couldn't find the mute button. Yes, it has. Thank you very much.
Yes. Okay. Thank you. Right. What
There's
else?
Some questions in the chat. Shall I read them out to you, Angela? Would that be
Yeah,
helpful?
go on then. That'd be good. Yeah.
Is the application form and information on how to apply available?
Yes, they are.
Yeah.
They should be. We'll put the links on here. They're also available through the landing page. You know, if you Google the Green Nursing Challenge through the Centre for Sustainable Healthcare, there are links to that, plus all sorts of other resources on there.
We'll pop the chat in the. We'll pop the link in the chat. Well, Olivia's made a really good point. Actually, would you be able to share your screen and show the application process? Would that be possible, Angela?
Let
Did
me
you have a
have a
template of
look.
what the application structure might look like?
Yes. Right. Give me a minute while I
I think the next question might be for you, Kath, just to warm you up.
Yeah.
A threshold for how many emissions are avoided, or is it more about process? Karen, are you okay to explain the question a little bit more, just in terms of what you mean by threshold?
I suppose I'm taking my reference is the public decarbonisation scheme that's from the government energy department, and they require that there's a certain sort of carbon per what's kind of like, you know, avoided to be able to be permissible. Permissible is not the right word. It's actually what I'm saying is, do you require some form of calculation of the embedded process carbon emissions before we start, or is that something that's done in the process of delivering the project?
Yeah, no, it's all done. So you get a lot of support from our sustainability analysts with the carbon emissions. So there's different ways of working out the emissions, but yeah, one of the things you would do throughout the project is get support in terms of what the impact will be, and that is, yeah, you don't have to have a kind of knowledge of what that's going to be before you start. I mean, obviously in the applications we want to see that there will be an impact. We've kind of thought about where the sustainability impact comes in, but not from a carbon point of view. You'll get full support to do that.
Okay, fantastic, thank you.
Yeah, so it's kind of the potential, I suppose, but yeah, we're not expecting people to have that knowledge when they apply.
The idea is that the challenge will equip you with those skills so that you can calculate and measure and demonstrate the impact that your project will have. So
yeah, and that's part of the part of the process is trying to understand the impact. You know, we don't know until we start to measure, and sometimes, you know, obviously it's kind of, you have to go through that study process to know what the impact's going to be. But it's that whole sustainable value is really important. So we're thinking about patient impact and social and financial impact as well.
Yeah, well, I think that's critical in going forward, is being able to do the triple win and convince the organisation to actually support that. So I think that's really fantastic.
I've actually been through the process as well myself, so I've been on from a clinical side, and I know when attending the workshops that sometimes teams have come with one idea and then the idea tends to kind of evolve as that process goes along. So they might have come with one idea and actually end up producing something that has evolved through that process and slightly different to what the original idea was. So yeah, the workshops are helpful for that. But I've got, if I can share my screen, sorry, hang on, I can show you what the application form looks like. So this is the first part. It's also, there's a link on the application form to the application information document, so I can come back to that in a minute. So applications require 2 project leads who are committed to leading a project and gathering a wider support. So it doesn't in the team, it doesn't necessarily need to be a team of nurses, but there does need to be a nurse that's actually leading the project, a qualified nurse. So what we're looking for here, what this application form is asking for, that you've read and understood the timeline and processes and those commitments. It wants to know what organisation you work for, the area that you're based and the setting that you're in, and your nursing specialty, the names of leads and the roles of departments, so email addresses. Then it's asking here, have any training or experience in undertaking a quality improvement project, and it's asking for some details around that, and why you would like to participate in the challenge. It's not allowing me to. Let me just see if I can. Let me just see if it'll let me move forward. No, it won't let me move forward without completing the document. Let me just go back and see if leave the site. Let me take you to the application information document. Can you see this that I've got on my screen here? Am I sharing it? Okay. So the two forms kind of interlink. It explains why we need one again, who can apply, and it lists some of the examples of nursing teams that might want to be involved, but this isn't a complete list by any stretch of the imagination. It outlines the dates, the shortlisting criteria, how we're going to select the teams, how it works. Gives you a little bit more detail about the different phases, the project phase and the awards and showcase, the principles of sustainable healthcare, and takes you back to the Centre for Sustainable Healthcare's Green Team competition with some examples there. So unfortunately, I can't share it in as much detail as you're asking for without completing the application form myself.
We can take any questions though while you go through the process, and it's anything that doesn't seem obvious, we can support and help you. And the application information I've just put in the chat, and the links to the application form as well to support you. Be right with you, Erica. Lovely to see you. Karen's just popped in the chat. Do we know roughly what the time commitment is? And Karen, just to give you some reassurance, you can have up to, it's about 6 in a team. Is that right, Angela and Kath? You can have up to 6 individuals in a team.
That sounds
good. I would say, I think with project, certainly the minimum is 2, because we don't just want this to be one person. Projects never work when it's just one person. You might want, because around 5 or 6 is kind of the ideal for a core project team, but there may be other people around that are supporting the work and other stakeholders. So and I was just in terms of Karen's question, happy to answer that. I think it's a little bit how long is a piece of string, but I would say realistically that you want to be thinking about at least half a day a week, just because, again, in terms of being a lead for a project, there are other people that you might want to bring in who are doing and allocate different bits of the work to. But there's the commitment of the workshop, which is definite. Then obviously the team at CSH are really supportive and flexible about how often you need to meet in terms of the project support. But then there's going to be work outside of that, and then the report write-up. So I think probably realistic is to say half a day a week, and then you kind of know that. But it could always be a bit more, a bit less, depending on how many other people you've got involved. So it's hard to say an exact figure.
From experience, it's good to choose something that's within your day job as well, so it makes it a lot easier to kind of implement and influence that change. But that doesn't mean you don't have to. If you're really passionate about something you want to lead, then obviously you'll find the time, won't you, to lead that change. Brilliant. Sarah, I'll answer your question in the chat, but we'll go to Erica next, if that's okay. It's lovely to see you, Erica.
Lovely to see you all too. Thanks for a presentation. I guess my question is, how long does this project need to be completed? So I think the project that would have the most scope and impact would be Cheshire and Mersey wound care formulary. So we're going to standardise the wound care, and that will help our patients and help our staff and feed into community as well, really, I suppose, in GP land. But this piece of work will take about minimum 2 years, so for the purpose of this challenge, does it have this must be completed by X date? That makes sense.
Should I answer that? No, I would say no, it doesn't have to be. What the challenge can do is predict, take a snapshot of the information that you've given and say over the course of a year, these are the predictions that by undertaking this challenge, these are the impacts, these are the outcomes. So sometimes it's having the idea and being able to sell that idea that will help galvanise that project, push that along. So that's my understanding, Lucy. I don't know if you would agree with that.
Yeah, no, I'd agree. If it's a big project, brilliant, fantastic. You can measure it along the way and demonstrate the impact. So as long as there's something you can measure, a change that you've made within that big event, it's very ambitious and brilliant project as well. So look forward to seeing an application. And lots of digitally enabled projects as well. Because I know obviously your field, Erica's digital, obviously have a huge sustainability element. So that's something to consider as well as how you measure that impact. So if anyone else is on the call thinking about that possibility, that's a good area to look at too. Great. I think there's any more questions?
Just answered one in the chat about the workshop. So we've got a set time, like a week set, which is in that project timeline for the workshops. But the application form does ask you for your availability within that week.
It might even be 2, Catherine, actually.
Over 2 weeks.
We extended it. Yeah.
Great. Yeah. So within a 2-week period, we'll ask you for your availability. And then obviously we'll work around you. We're very, we're all clinicians by background and we know how difficult it is. But yeah, anyone who's kind of leading the project, we strongly suggest that they do come because it's a learning opportunity. And we want you to be involved. So it can be, again, sort of doesn't just have to be the two people, but yeah, people who are heavily involved in the work.
And we will try and be flexible and work around the availabilities that you have as clinicians. So we've kind of put different dates and times over the course of a week, and we've kind of blocked out those times from our diaries so that we can be flexible to fit in around you.
And just a final thing I might add as well, and obviously we've half the place of a community, but we're very keen to see social care applications as well. We really do believe it's health, and I'm glad Matt and you, Amanda, would nod too, but health and social care, it's across the whole health and social care system. And there is so much to learn from the social care sector as well, because to be fair to them, I think I've been to a few events and well, actually we've been running on low resources for years, so we can share and learn from one another as well. So there's really would actively encourage from that area too. Great.
Just new messages down at the bottom.
No, I think that's no questions. I think that might be it.
That might be it. Thank you very much, everybody, for joining us. We look forward to seeing your applications. Thank you very much to our speakers, Amanda, Marion, Lucy, Catherine, for stepping in at the last minute. Thanks a million.
Thank you.
Okay.